Hello, everyone. Welcome. My name is Mandeep Grewal, and today I will be talking about a COVID-19 based case study as an animal health officer for one of my courses in Masters of Public Health. We know that this COVID disease originated in China back in 2019, where clustered cases of pneumonia were reported to be seen in Wuhan, and they were all associated with seafood wholesale market. And after this, the COVID disease or virus had rapidly spread to all the countries around the globe because of this person-to-person transmission and had resulted in significant morbidity as well as mortality. Now, this COVID disease is also known as SARS-CoV-2, which is named after its clinical manifestation of severe acute respiratory syndrome, coronavirus type 2. Now, before going into further details, I would like to very briefly go over my role as animal health officer. And it is my duty to ensure that all the animals are kept in safe environments, that they are not being abused or neglected, to ensure that all facilities are operating in compliance with state and federal laws that entails animal health, safety, and welfare. And this is all done by inspecting the facilities to identify, control, prevent, and eliminate any diseases via assessing and evaluating the animals and their environment. We also deliver quarantines or isolate the animals that are reported by state veterinarians to be diseased, or facilities that are not seen in compliance with the health standards. So in other terms, we're working very closely with the state veterinarians. Also, we explain the laws and regulations to employers and employees, both verbally and in writing, the laws that are involved in raising, selling, transporting, caring of animals. Then preparing and maintaining reports is also very important when we go and gather information on these field trips. Then testifying at hearings is another role, and training other animal health inspectors is also our duty. And most importantly, issuing the license to breeders, pet stores, and rescue groups in our area, as well as shutting down if there's any unlicensed activity or a facility that is not in compliance with the health standards. Now, after this, let's look at the coronavirus. What exactly is coronavirus? So it is found in wildlife species, mostly bats, because they are the natural habitants of coronavirus. And there are 4 types of coronaviruses that are known so far: alpha, beta, gamma, and delta. Out of these 4, only alpha and beta are known ancestral origins of mammalian coronaviruses. Now, a little bit of background information on how we came to know these coronaviruses is when we had to deal, we as humans, had to deal with these viruses, and there were outbreaks. The first one was back in 2002 in southern China, where the first type of coronavirus was known to had spread from bats to the wild cats and then to humans. So as we know that the bats are the natural habitants, they are the species where viruses spend all of their life. So they are the reservoirs, and intermediate host is a one where the virus only spends part of its life cycle. Then next outbreak was seen in 2005, again in Chinese wet markets, and horseshoe bats were the reservoirs where cavets, these are again the wild cats, were seen as intermediate hosts. And back in 2012, we saw MERS coronavirus, which was the Middle East respiratory syndrome, spreading from bats and alpacas to camels this time, and then came to humans. Now, coming to the COVID-19, we know that it originated in Wuhan. And after this presentation, we are going to learn the possible reservoir and the intermediate hosts. So for COVID-19, we know the studies have reported us that 96.2% of genomic similarity was seen in the bat coronavirus and the SARS coronavirus type 2. So we're hypothesizing that this virus has come from bats. But interestingly, in these local Chinese markets, bats were never sold. However, the snakes were reportedly sold, and humans were known to interact with these snakes. Another study showed that 91.02% of genomic similarity was seen in the SARS coronavirus and pangolin coronavirus. Now, this was interesting because there were reported of interaction between humans and Malayan pangolins. So this could be the intermediate host that had brought this virus to humans. Now, next, let's see how these viruses are transmitted from one species to another species or within the species. And this is a great illustration of showing the animal to animal transmission, and then animal to human and human to human. Interestingly, human to animal transmissions for this coronavirus have also been seen, and there have been cases reported on coronavirus disease in cats and dogs. So the domestic animals can also get infected with these viruses. After knowing how, it is important when these transmissions can occur. So the animal to animal transmission can occur when we are breeding these animals with each other. And because of the urbanization and proximity of humans, we can transmit these viruses from within our species. Now, the next part is to intervene and stop the transmission to occur at first place, which is basically the primary prevention. And we, as animal health officer, can put in bans to the markets where the viruses are being originated, and issuing the public recommendations to follow appropriate hygiene practices whenever we're handling or interacting with animals, either domestic or wildlife. So following the personal hygiene, like proper hand washing, using the personal protective equipment at workplace, keeping the environment healthy and safe for everyone is very important. At the end, it is very important to understand this concept of One Health because it provides us the approach to resolve these infectious diseases and prevent them from occurring at the first place. So having a systemic surveillance of all zoonotic courses in the different animal species, as well as of professionals who have greater exposure to zoonotic risks, for example, farmers or butchers, is very important because if we are monitoring for these viruses and actively recording the health of workers, animals, as well as the general public, then we can detect these infectious diseases at earlier stages. And this current pandemic really demands us to have this collaborative One Health approach internationally. Lastly, we should include this One Health approach in educating and training programs at workplace without a doubt. So here are my resources. Thank you for your time.